Welcome, everyone, and thank you for joining us. I'm glad you're here for this expert education presentation from the Sashbear Foundation. I'm Carol Moffat, and I have the privilege of being a volunteer with the Sashbear organization and a family member who has benefited from the program and the resources offered. Our family loves all things Sashbear and excited to be here with you tonight to learn about the system change happening through partnership. Thank you again for joining us tonight, and I would like to now introduce our expert speaker, Dr. Joe Henderson. And as you'll hear, Joe comes with a wealth of experience in education. I was exhausted for her reading her bio. Just has done so much and doesn't appear to be, 100 years old. And we're especially grateful to have Joe here tonight. She has stepped aside. She's at a conference and she's stepped out so that she can be with us for the next hour. So Joe is a scientific director of the McCain Center for Child, Youth, and Family Mental Health at the Center for Addiction and Mental Health and professor of psychiatry at the University of Toronto. Joe's also the executive director of Youth Wellness Hubs Ontario, one of Canada's leading integrated youth services initiatives. Joe's passion and research focuses on improving access to care, service experiences, and outcomes with and for youth with substance use and mental health concerns and their families. Joe's committed to youth and family engagement, equity-focused approaches, partnership, knowledge exchange, and continuous learning. Joe currently leads multiple projects across Canada that focuses on strengthening youth systems of care through amplifying youth voices, building cross-sectoral networks for community partners, and building data governance models that are equity-focused and center youth perspectives. Wow, it's a lot. And she's here tonight, and she's going to share lots with us. So especially for those out there with youth, settle in for lots of good information tonight. Over to you, Joe. Thank you.
Excellent. Thank you very much. I'm really, really pleased to be here this evening. Sashbear is very close to my heart, and the work that we've been able to do in partnership has been so important over the last number of years. I'm going to try and do a decade plus or minus a few years of work and partnership in a relatively short period of time, maybe the next 30, 35 minutes, and then really try and save some time for discussion. And I am talking to like my own screen, so that's always a little weird. I will, look forward to having more interaction at the end. I should say this image that you see here is our brand, and this was co-created with youth, and our tagline, Wellness Your Way, these are from Youth Wellness Hubs Ontario, and these were co-created with youth with lived and living experience and expertise of mental health and substance use concerns. Before I get started, I just want to acknowledge that I have the privilege of telling you all about this work today, but this work has been co-created by hundreds, thousands of young people, family members, service providers, other researchers, like I said, over the last decade. And so while I get to share it with you, it really is our collective work, and it's important to acknowledge that. So I'm going to tell you about sort of our most important lessons to date, kind of get to the punchline at the outset, walk you through really what has been incredible system transformation, thanks in part to many members of the Sashbear community, and then really open it up for discussion at the end. So this is like my very busy slide that just like, the point of saying, the point of this slide is to really say, change takes time. And it can feel really challenging when we don't see change happening fast enough. And we do need change to happen faster. And change takes time. Some of our most important lessons, I said I was going to get to sort of the punchline at the beginning. Some of the most important lessons I think we've had are really about the importance of integrated models of service delivery, how we bring different parts of the system together to deliver on a promise to young people to support them in achieving their best outcomes, the importance of being guided by science in all different ways, both in terms of the interventions that are offered, like I know Family Connections is based on evidence, but even when we're trying to implement something new, thinking from an implementation science perspective, the critically important value critical importance and value of lived experience and living experience and expertise to all of the work we're doing, the importance of partnership, and really thinking from a human rights and justice perspective. Ultimately, we need mental health to have parity with the rest of the healthcare system. We need the lives of young people to be valued equivalently to all other lives. And we really need to shift our thinking to one of a human rights and justice focus, in my perspective. Okay, so what did all this work? The last slide just kind of like oh, actually, I need to go back to the last slide for 1 second. You will notice, I can't quite see it because of whatever, bottom corner, there's a photo. You should be able to pick Lynn out of that photo. This is a project that I'm going to tell you about that really becomes the impetus for what has been transformative change across Canada. And it really is a group of people, many groups of people who work together, including Lynn, to make this change happen. One of the early things we did between 2009 and 2014 is we worked with youth, family members, and service providers across the country to understand, to gather data. When we could see in the data, there were lots of challenges, but also to sit and have conversations and build relationships, to talk about what are some of the challenges that are being faced by youth and families. And they were the usual. These are not things that would be a surprise to you. Importantly, we also went to the next step, which was to say, what are the solutions? What do you need? How should the system be redesigned? And based on that, we were able to create a new model of service delivery called Youth Can Impact. And many Sashbear community members were engaged in this work. We understood from family members, as well as youth and service providers, that we really needed to move away from a specialist model where young people and families had to go through many, many steps in order to access service, but really create a model of service delivery that was in the community that allowed young people to immediately access service when they needed it. That those services needed to include intervention at every touch point, so solution-focused brief therapy, and that services needed to be tailored to the level of difficulties that a young person and their families may be feeling and experiencing. You'll see that not only were we thinking about mental health and substance use services being delivered, but we were thinking about how those should be embedded in a whole wide range of services. We had heard consistently from youth and family members and service providers as well about the need to pay attention to the holistic needs of youth and families, not just their mental health needs in isolation. And so we put together some things that should seem rather familiar to you here. We put together a model of service delivery that included things like DBT skills groups for youth, and also family connections you'll see in one of those yellow circles at the bottom. Now, this model of service delivery was built collaboratively with community-based service providers, youth and family members, really arguing that we needed to move services closer to where young people were and make them readily available in the evenings and on the weekends, that they could be accessed without any referral, and that we needed to be able to take some of the high-intensity specialized services like psychiatry and embed it right in these community-based services, allowing young people to access the services as quickly as possible. This model of service delivery might seem really unsurprising at this point in time. But in 2015, This was a new model of service delivery. Services were not being delivered like this, and in many places they still aren't. In many places, it's still a single organization delivering services on their own with whatever idiosyncratic model of service delivery they might have. But in many more communities now, both in Ontario and across the country, people are starting to work in these ways. People are starting to work in ways where young people can walk in, have their goals understood, have their families' goals understood, have a small amount of kind of needs assessment, but not yet another assessment where you have to retell your story, just enough to be able to do some immediate planning. And they're really moving right into intervention services. These are sometimes called one-stop shops. They are happening around the world, but Canada has really been identified as a leader in work in this space. Now, we did a randomized, actually, I'm going to turn back for 1 second. We did a randomized control trial. For those of you who don't know what a randomized control trial is, it's the gold standard of, it's the theoretical gold standard, it's the conventional science kind of gold standard of comparing two approaches to solving the same problem. And our conventional approach to solving the most significant mental health and substance use concern is really the adolescent outpatient. Inpatient would be the most severe, but sort of thinking from an outpatient perspective, adolescent outpatient psychiatry unit in a hospital. That's where most psychiatrists sit. And that's how most young people would get access to psychiatry services. Young people and their families would be referred by a family doctor to a hospital and then access. Typically, psychiatrists see young people first, and then a treatment plan is developed. They do an assessment, a treatment plan is developed. I'm sure I'm telling most of you experiences you've already been through. Those treatment plans then get referred to others to execute, typically, maybe inside the organization, maybe outside the organization. We wanted to do a really rigorous test of the Youth Can Impact new model of care, which we call the Integrated Collaborative Care Team. And Lynn and others, like I said, co-created this model. We wanted to test this new model against this very, high standard of care that is this hospital-based adolescent outpatient psychiatry services. So we had 5 hospitals in the Toronto area: CAMH, Sick Kids, Sunnybrook, North York General, and Michael Garron Hospital. These were the hospitals who participated in the trial. Young people would be referred to the hospital. At the front door, the sort of intake front door of the hospital, they would be invited to participate in this randomized control trial. And if they agreed to participate, they were then randomly assigned either to the service they were already going to receive or to this new model of service delivery, sitting in 3 community-based locations in Toronto, one in Scarborough, one in East Toronto, and one in Central Toronto. Now, we followed young people over time. We examined how similar they were at the outset, and we looked again at 6 months and 12 months to see how they were doing. We examined it from all different perspectives, from the youth's self-report about their needs and their functioning, from the parents' perspective of their young person's needs and functioning, their symptoms, from their service experience, all kinds of different perspectives we examined over time. Interestingly, what we found, and you don't need to sort of know all the details of this, but what we found, fortunate for psychiatry as well, is that both groups, young people who had gone to the outpatient psychiatry services and young people who had been randomly assigned to the community-based Youth Can Impact model, improved. The graph you see in front of you is particularly about their level of impairment, which is really kind of the Columbia Impairment Scale looks at functioning. From an impairment perspective, we really try to use strength-based approaches and measures now, but at the time, this is what we were using. And what you can see here is that their level of impairment decreased from when they first entered the study to 6 months and 12 months. The most important thing, though, is that there aren't significant differences between these two groups. Both groups improved, and they were not significantly different. The impacts were not significantly different. Now, this is really interesting because we often think, and parents in particular, myself being one, often think that psychiatry is your best kind of care to have, that they're the most expert and they have the most to offer. And certainly, there are certain contexts within which that's critically important. And it is also the case that it's really hard to have psychiatry throughout a whole system, especially a province like Ontario that has a really big geographic area and population, that's distributed. We don't have psychiatrists throughout the province of Ontario. Similarly, across Canada, which isn't even the second largest landmass in the world, we don't have enough psychiatrists. We will never have enough psychiatrists to distribute across the whole country to meet all of the needs of young people with mental health and substance use concerns. And what this shows us is that community, other professionals also can have significant positive impacts on the mental health needs of young people. Substance use was interesting because we saw an indication, and I should say there's lots of details and happy to talk about all the details, but this study unfortunately was impacted by the pandemic. So we aimed to do this study with 500 young people and we had to stop at 247. And what that means is we can't test, our tests aren't as robust as we would like them to be. You have to have much bigger differences in order to capture it with a small number of people. What we see here is that when it comes to substance use, we saw a sign that the community-based approach, the integrated collaborative care team, youth can impact approach, outperformed our treatment as usual in the hospital-based settings. Now, this is important because young people who are struggling with substance use health-related concerns are quite poorly served by the system. And what this tells us is that if we can build more robust services in the community, we have a good shot at meeting the needs of those young people. So interestingly, simultaneously while this work was unfolding, we had the opportunity to start to build out Youth Wellness Hubs Ontario. This was a model of service delivery that was heavily inspired by Youth Can Impact. Basically, the long and short of it is that while we were implementing Youth Can Impact in Toronto, the government became aware of the work we were doing and wanted to explore the feasibility and the effectiveness of the same model, but in places outside of Toronto. So places throughout Ontario, small communities, rural communities, northern communities, francophone communities, First Nations communities, really thinking about all of the different kinds of communities that are in Ontario, and to take the model and sort of test it in those contexts, not with the same kind of really rigorous clinical trial, randomized clinical trial as Youth Can Impact, but in a more evaluative perspective, where we're examining kind of change over time, but without a comparison group. And so we started the work of Youth Wellness Hubs Ontario in 2017. Now, when you co-design something, we may think that we've done a great job, and I think I mentioned we started in 2009 and then through to 2014, but we're now in 2017 when this work is starting. It's like practically a different generation. So we took the time to go back and to do another round of co-creation, co-design with youth and families and service providers, focusing very much on the Ontario context, to really understand what the current needs were at the time and how we could update the model if any updates were needed, or add new parts or take parts away in order to build a model that would be relevant across the province. And what we understood was of particular importance to people in Ontario was that there was really this mess of services that were not well organized, There were very few services for transition age youth. And people really wanted to have something like Youth Wellness Hubs Ontario help to organize existing services into a system of care. And so we looked for communities who volunteered to, who put up their hands and said, you know, we're not satisfied with how we're supporting young people in our community. We want to come together and we want to do things differently in order to support young people differently. And we're going to put youth at the center, youth and families at the center, and we're going to organize ourselves to deliver care in this one-stop shop model of care. Or integrated, we now call it integrated youth services, in a one location, but it goes beyond co-location. It's really about the integration of services, and really to take our resources and to organize them more effectively so that young people can get better access to higher quality care. And so WIHU, we call it WIHU for short. WIHU focuses on free, rapid access to mental health, substance use health, physical and sexual health, and other community and social services. And they are for young people aged 12 to 25. Like development, you know how development can sometimes challenge a young person in a way that exceeds their coping resources. And then at other times, things are going well. Our model is built so that young people can move in and out of services or stay connected to services for that whole developmental time frame. So the whole 13 years. You join the club, you can stay part of the club the entire time. And we bring together all different resources in the community, some of them clinical, some of them not clinical, and I'll tell you more about that in a second. And in addition, we embed a youth wellness team that's comprised of a mental health and substance use clinician, nurse practitioner, care navigator, peer support worker, and measurement-based care coordinator. Our priorities were really to build a system of care that centers youth experience and outcomes and reduce fragmentation and gaps in care. And to do this by really being intentional on our focus on outcomes, examining the equity of outcomes across different contexts, meeting the needs of transition age youth, as I said before, and really trying to engage with young people who aren't wouldn't be engaged in the system regularly. And we operate as a learning health system. And I think for some of you, this might be a new concept, but really the idea is pretty straightforward. It's the idea that we embed measurement in everything we do, so that we can understand the impact of the work that we're doing. And that can be measurement at the level of the individual, but also measurement at the level of the hub, the youth hub, and then measurement at the level of a system. And then we use those data that we gather, those measures that we do, to understand what's going well and where are there gaps. And then we use existing evidence-based practices, or we generate evidence about a new practice to address those gaps, and then we reevaluate. And this kind of continuous operation as a learning health system allows us to continuously improve, but also to bring together what have been, and I think this is another takeaway that I'd like people to hear, especially since Sashbear has been so important, Sashbear members have been so important, the idea that we can bring together research and practice and lived experience into a collaborative way of continuously enhancing the services that are available to all of our collective youth. I'm a parent of two young people myself. They're 25 and 21. So it's close to home, thinking about how to meet the needs of young people. So we started out in 2017 with the 3 sites that we were the research sites, and then we added another 7, and so we had 10 for a 3-year demonstration initiative, and they were spread across the province. And now, just a really relatively short period of time later, just 6 or 7 years later, we actually have 32 funded networks across the province of Ontario Currently, there are hubs operating in more than 40 communities, and there's more to come online very, very soon. Our services have really built on that very original Youth Can Impact model that we co-created to include mental health and substance use services. And what you see here are kind of different levels of care under each of these service pathways. So we have mental health and substance use health, primary care, peer support and care coordination, community and social support services, and skills and well-being activities. These skills and well-being activities, one of the things we learned from youth and families was that youth and families really want to be able to come in and check things out to get to, especially the youth, really want to get to know the people and build relationships before they start having conversations about concerns that they have that might be very personal. They don't want to have to tell and retell their story only to find out that they've told their whole story to someone who isn't going to be able to help or with whom they don't feel comfortable. They really want to be able to make those connections. And so a really important piece of Youth Wellness Hubs Ontario, expanding on that Youth Can Impact model, was to build out, those yellow circles that were at the bottom of that diagram, build out those yellow circles to not only include a wide range of kind of clinical and support services, but also more generic kinds of services, things like cooking classes, hiking opportunities, time in nature, 2S LGBTQ social night, gaming competitions, things that draw young people into a space. It's a little bit like the sociological sort of idea of a third space. Youth spend time at home and they spend time at school. And these are two structures that each in their own way are there to support young people. But what's in between? Where's the space that has been created by youth for youth? And that's really what YWHO does, is it embeds these kind of clinical services in this kind of third space idea, where youth are creating for themselves a place in the community where they can connect, where they can learn, and where they can build those relationships that can facilitate getting onto that pathway to support. We really operate around core components as opposed to thinking about what specific services each hub offers. Because the model is built on what's already available in a community, we can be really constrained in communities that have fewer resources. This is a problem we continue to work on. And so we really, instead of starting with making sure each service widget is available in each community, we started by what are the guiding principles? What are the core components about the way we work that need to be in place in order for us to achieve different outcomes? So youth engagement, family engagement, integrated governance, ready access to high quality services, paying attention to cultural diversity, diverse identities, ensuring seamless experience of care that integrated service delivery, and then measurement-based care. We can't improve if we don't measure. We have to measure. And I consider it my commitment to young people. I'm accountable to youth and families for outcomes. We need to be able to say what the outcomes are and to be accountable for them. And equity is really critical to the work we do, and that's woven. I've kind of got it here as 5 pillars, but it's really woven throughout all of the work we do, and hopefully that's evident from kind of these short descriptors. And because we were trying to address fragmentation, really was about bringing services together. And we have a whole wide range of services that gives you a bit of a sense of the different services outside of our formal clinical mental health and substance use treatments. We have a whole wide range of services that support young people. Data has been critically important as well. And it really has allowed us to integrate in a way that most other organizations have not been able to do. And I, really commend Sashbear for doing ongoing evaluation of family connections, because really that level of commitment to gathering data systematically, consistently, and then using it to guide your planning is really, really important. And, unfortunately absent from many parts of the system. So this has been really important. So what happens when we work together? I mentioned that some of our key messages are really around integration, using an evidence-based and evidence-generating approach like implementation science to guide our work, thinking about partnerships. I'm going to tell you a little bit more about our partnerships and how we have achieved. This has been, it's quite unlike things that have been accomplished in the past. And it's really because it's been a collective who have worked on this. What we have identified as some of the core, the critical aspects of our work that have allowed us to integrate in this new way, really about having shared goals and vision, about sharing resources and power, by focusing on supporting youth to move seamlessly through care pathways, ensuring we have no exclusions for service, we are completely inclusive, ensuring we emphasize communication, collaboration, coordination, having an integrated data system, and typically sharing a space, though not always. We did this really cool, we wanted to understand the extent to which we actually were achieving what we set out to achieve in terms of this integration. How do we work together? I can't say for sure that I've heard Lynn say this before, but I feel like I've heard Lynn say this before. It really does take all of us supporting one another, working together to raise the healthiest children possible. But how do we capture that value? And so we've been using something called social network analysis to try to understand changes in how we're working together over time. And so we recently did yet another round. I just thought I'd show you, I'm not even going to really talk about this too much, but just to say this is really interesting, it's maybe something for Sashbear to think about in terms of all of that network building that you do. This is the kind of output that comes from doing social network analysis. You have all of these different organizations. We did this when there were 22 networks who could participate. Each of these different colors is a different network, and the dots and the lines show you the extent to which the different organizations are connecting with one another, how close they are, how strong their relationship is. And they do tons and tons of analyses that can really help us to reflect on where are our strengths in our partnerships and where are the parts where we can work more. But I'm sure that you are really interested in hearing about how the Why-Who model that, like I said, was co-created by many of you in the room, was inspired by Youth Can Impact. How are we doing in terms of that vision of reaching young people who could benefit from service, but were not yet connected to service? Well, you can see here I'm showing 3 years of data. So 2021, 22, 23. And we're distinguishing between registered services, so those would be our clinical services, the skills and well-being activities that I talked to you about, and then both of those things combined. And you can see that we have steadily increased the number of visits to Why-Who by young people across the province. And in 2023, we had over 185,000 visits by young people. And when we look at that was cumulative, this is by year, each year. What you can see is each year we have had more young people participating, and in 2024, we're on track to have yet again another year of significant growth. And so now we're up over 300,000 visits to Why-Who by young people across the province, young people 12 to 25. And 67,000 of those visits were for clinical services. When we look at, an important question, because volumes actually don't tell us very much, a first step is to understand how many of these youth are separate individual youth. Are they coming for service once? Is one youth coming for service 125 times, or are 125 youth coming once, or some combination of the two? And so what you can see here is that we have again had increasing numbers of individual young people accessing services over time. And we estimate, part of it is estimating those skills and well-being activities. We don't have full data collection on youth who present for those, but we're confident that over 55,000 young people, individual young people, have interacted with YHU over the last few years. Now, family members are critically important in supporting young people to connect to services like YHU, and I'm sure that many of you, have spent substantial amounts of time trying to identify, find, connect to, follow up, follow through to another service for services for the youth who may be in your life. In Youth Wellness Hubs Ontario, family members are the most common way that youth find out about YHU. And it's about a quarter of youth find out about YHU through their family members. So I want to circle back to the beginning, and then I'm going to stop, which is the role of research. I think for me, it has been such a privilege to partner with Lynn and other members of Sashbear through Family Connections, and really through our joint interest in building the evidence around the best ways to support young people. And one of the notable changes that kind of aligns with the model of service delivery is we've really been working hard across Canada to move away from having people, especially we're such a small community of researchers, youth mental health researchers in Canada, to really try to move away from competing with one another to collaborating with one another. It's really challenging in low resource kind of context, like research funding in Canada for youth mental health or service dollars. There's just like you end up feeling pressured to compete to get a piece of the pie. Now, we've really worked hard to focus on how much more we can do when we partner together, when we collect the same data, when we use the same data platforms, when we use the same models. We can go so much further than when we compete and each do things a little bit differently. And so really excitingly, across Canada, while in Ontario it's called Youth Wellness Hubs Ontario, across Canada, integrated youth services have been developing. In BC, it's Foundry, Alberta, it's Kickstand, Saskatchewan, actually I have to update this slide, it's called Home Base now, Manitoba, it's Huddle. We have across the country similar models of service delivery, similar commitments to working together. We've been conducting research all the way along on the integrated model of service delivery, and also building a shared data platform that will allow us to examine our data together so that we can answer bigger questions than any of us can answer alone. And that takes me to the role that you can play as well. We are constantly trying to improve, because we're a learning health system, we're constantly trying to improve the services we offer. And we have two opportunities available to family members right now. And you don't have to have extensive experience with YHU to be involved. You can learn more about the care model and provide your input that way. There's a QR code here that you can click on to find out more. similarly, we are conducting a study that our youth engagement team have called CARES, which is focused on how we're meeting the unique needs of girls, women, trans girls and women, and gender diverse youth, and really trying to understand what those services need to look like. And we're really interested in the perspectives of family members and caregivers. So if that's something you're interested in, you can, we would be really excited to have you involved. And then these are our ways of connecting. Oh, I think I have a QR code here if you want to scan that to get quickly to the youthhubs.ca webpage. And I think my last slide is just my favorite, which is my canoe looking out at a lake in Killarney. And I hope that this little webinar has given you a bit of a sense of how your efforts have contributed to system transformation, the key ingredients, I think, to making partnership and system transformation happen, and how you might get involved going forward in research that I think can continue to transform our system. Leave it there to turn it over to questions and discussion.
Great. Thank you so much. That was interesting. That was great. And we really appreciate you stepping out of your conference. So we're going to get to Q&A in just a second. So please stay tuned. I just want to, I know sometimes people have to drop off, so I just want to kind of get one more message out there if possible. We do hope that everyone enjoyed this session and found it valuable. And if you like what you heard, we do invite you to consider making a donation to Sashbear. And the link will be in the chat. And that is to enable us to continue having these kinds of conversations, being able to provide the Family Connections program. Sashbear is a nonprofit with over 200 volunteers, with our donations going directly towards the materials and the resources to provide such services. So if you can do that, thank you in advance. That would be awesome. And we'll go back to our regular programming here and jump into the Q&A. We had a couple of questions come up. So I want to understand with kind of at the beginning, if we talk about intake, and you're doing that initial needs assessment. And because there is that self-referral element to the integrated system, how do you validate what a youth may be sharing for accuracy, for, I'm going to say, truth, or are you also talking to family members to kind of collaborate what information they're providing when they're coming into that system?
So I think we approach it a little bit differently. So because youth aren't being referred to the program, so I'm a clinical psychologist by background, and so practice clinically. Right now, I'm not practicing clinically so much, but you know, when youth reach out for support on their own, they're reaching out because they are internally driven to seek the kinds of supports they perceive themselves to need and want in order to achieve the goals they have for themselves. And that is a fantastic place to be able to start. Because when you have a young person who's putting up their hand and saying, I need support, you are so much further ahead than, and I feel like many people have had this experience where you're kind of like, really coaxing your young person through the door. And when you're saying, well, this is the problem, and they might be saying that's not actually a problem, and you get into that stance, it's very different. That's like part of why the model sort of really emphasizes young people being able to walk in and reach out on their own, is because that allows us to engage with them. And I think we de-emphasize that there is one truth. We work from the standpoint of starting where this young person is at, presuming that there's more to the story. There's always more to the story. There's more to the story, for all of us in every context. We don't need to necessarily, certainly not have a young person tell and retell the story that could be very traumatizing to them in order to offer good service. When we measure over time, that actually allows us to do a much better job of understanding the impact we're having than that sort of sense of like, have I gotten everything really specifically kind of like, do I have a handle on the truth? In terms of, do we gather information from other sources? As the usual, with consent, we absolutely encourage young people to draw in the support people they identify. And we definitely are communicating back to other care providers who are in their circle of care in order to deliver sort of the best care possible.
So that leads into my next question. That was like perfect segue. You think we rehearsed it, but we didn't, you guys, because I knew nothing coming into this. So, we couldn't have. But where does consent fit into this? So if I'm a 14-year-old, um, and can I self-refer myself because it's 12 to 25, but there's that consent thing up until 18, right? How does that play into it? Because you just mentioned consent from those other sources, but that initial consent, does that come into play somewhere?
So youth have to, even though they're walking in the door and asking for support, you might presume that there's implied consent, but we still seek active consent from youth for participation in our services.
Right. And are all of these services covered under like the provincial plans?
They're
And
all free, all
and
free.
and so people can also take advantage of it if they don't have a family doctor because they're coming into
Absolutely.
the system all different ways. Is that right?
Absolutely. And one of the really cool things that actually I didn't learn until the start of all of this work back in like 2015 is that nurse practitioners here in the province of Ontario have almost a fully overlapping scope of practice with psychiatry. They can do diagnostic assessments, diagnoses, they can
Oh,
prescribe psychotropic medication, almost all of the same medications that psychiatry, and they can do medication monitoring. And so there are significant issues of family doctor shortages in the province of Ontario. And in addition to that, as young people, develop over the course of adolescence and into early adulthood, they don't necessarily want to go see their mom's doctor. Like my daughter's like, I don't actually want to go see the same person that I've seen my whole life. I want to go and talk to someone who's my person, as a young
mhm.
person. And so we're able to create that opportunity through offering primary care services. Some of our hubs have family docs, but mostly it's nurse practitioners.
Right. And what are the expansion plans? So I know you put up some of the areas, right? So I'll use an example, Peterborough.
Right.
When is Peterborough gonna get their little pin on the map to say we're here?
Yes.
And other areas, obviously, right? I mean, that's one example.
Yeah. We're really so the number of communities who are interested in implementing this model exceeds the funding that's available from the government at this point in time. Minister Tobolo, who is the Minister of Mental Health and Addictions here in Ontario, he is a very big proponent of Youth Wellness Hubs Ontario and has made amazing investments in this model and expanding this model really quite rapidly. And we still have like 50 communities, more than 50 communities on our list of communities who are ready to go and want to implement this model. So we go as fast as the funding. We try to offer a fair number of supports without any funding as well, but ultimately that's what's needed.
And how does this work with, if we're talking about youth in, I'm going to say, other situations, whether it's homelessness, they're caught up in the Children's Aid Society in there. So whether, history of abuse or abandonment, whatever it might be that falls in there. And then you kind of get to the neurodiverse of youth, like that whole range, right? It's everybody isn't coming from that. Do nuclear families even exist anymore? Kind of thing. Like, do you know what I mean? I don't know
Yeah,
if I'm wording this well, and I'm trying to combine a couple different questions from
sure.
people to kind of
Yeah, for sure.
pull in everybody.
Yes. So we are a trans diagnostic service, which means you can come in the door with no diagnosis, an underlying diagnosis that hasn't been identified, multiple diagnoses. Everyone is welcome. And so, from that perspective, that is like we don't necessarily, like, say for example a young person comes in the door and they're showing signs of an emerging psychosis. It's not that all of their services could be at the hub, but our care navigator will walk with that young person along that journey as their support from the hub while we connect them to specialist services for psychosis, for example. But they can still come to us LGBTQ social night, and they can get employment supports or substance use supports at the hub. So you can belong to more than one family. In terms of young people who are particularly facing many structural and systemic barriers to achieving optimal health, we definitely serve those young people as well. It really depends in part on the community. So in Toronto, for example, there are robust services for youth who are experiencing homelessness or precarious housing. So the hubs don't do so much of that work. But in Kenora, Ontario, or Renfrew, Ontario, where there are no other services for youth experiencing homelessness, the hubs do much more of that kind of work. They may have showers and laundry facilities. In Renfrew, we have an emergency bed. So we really flex in response to the needs in the community. I'm really pleased to say, and I don't know if any of you listen to CBC, but on CBC this morning or yesterday morning, Peel Children's Aid Society was talking about how they are the first, they're one of our new sites, and they're going to be hosting a youth wellness hub in Brampton. And this will be the first time where a child welfare organization will be the lead for the youth wellness hub, and with a really intentional effort to meet the unique needs of young people who have been involved with the child welfare system.
So, along those same lines, if I am in a community that doesn't have services, can I go to another location? So can I, get myself on a bus and go to another community that's an hour, 2 hours away, and take advantage of their service, of the hub being
Yes.
offered there?
Absolutely. Absolutely. So we have no catchment areas. So you can see this was designed with youth and family members who said, this is ridiculous that I have to sit in a community that has no services, and the community over there has services. I'm not allowed to go there. There are no catchment areas. In addition to that, we're just building our virtual. If you go on the website, there'll be a link to our there'll be information about the virtual services we're building. Ultimately, we're not quite there yet, but ultimately the virtual services will be available. And it's not just like we're going to replicate the integrated youth services model virtually. So it'll include sexual health care, for example. It'll include mental health and substance use, but also employment services, all virtually available across the province. We're still at the beginning stages of that, like a demonstration phase. And that's been funded by philanthropy. So RBC Foundation has been the big supporters of that. So like yourselves, sometimes the best supports and services come through philanthropy, because it gives us the opportunity to really do things that government might be too anxious to do quite yet.
Okay, so we're nearing the end of our time, but I'm going to throw in another question because I feel like I've kind of put a bow on things. So we're doing 12 to 25. What happens when I'm going to turn 26 and I've had this great experience? Where do I roll off to?
Yes, well, that is, that is a concern that keeps me awake at night some nights. I would say we don't have a hard stop. So we're not, I mean, I don't, anyone who knows, well, anyways, I won't say the person's name, but, we talk about it, the Wellington Guelph Hub. I once said in passing, someone in a forum like this asked me a question about, like, what about if a 52-year-old person walks in the hub, then what do you do? And I said, you serve them. Like, that's what we're about. And then they actually had that happen at one of the Wellington Guelph hubs. An adult person, like fully adult, like way down the adult path, walked in and needed support. And the staff served them and connected them to the right services in the community, followed up, made sure they were connected. We're not kicking young people out. There is no admission, discharge. Oh, now you're discharged. Oh, you missed your appointment. You got to start again. None of that. These
Right.
this is your place, and we're going to support young people.
That was awesome. That is good to hear. Um, because some of us that are further along the adult life, sometimes we don't feel like we're that far along. Sorry, I'm self-projecting there.
Well,
And the more challenges you have, the more you're sort of thinking, I need to go back and start again.
yeah,
Um,
yeah.
this has been very informative. Now, if we go to the website, is there also on the website, does it give the links to other provinces and similar services there, or where can people find information? We are a national organization. I know
Yeah.
we've got folks online from across the country. Like, where would I go and get information if I'm in Alberta? Like, is that on your website? Those links? Yes.
That is a good question. We are about to launch a pan-Canadian IYS website, I think tomorrow. But at this particular moment in time, if you Googled integrated youth services, Canada, and probably the Graham Beck Foundation, so GBF, has probably a good website where it lists the most up-to-date information about each of the hubs. But as of tomorrow, it'll be IYS dash SE, so in French, the same
Now,
initials
will
in
there
French.
be a link on your site tomorrow with that
Yeah,
new information?
that's a good point. I will make sure that happens. I will try to make sure that happens.
In the next week or so, we're good. We're
Yes,
flexible. We can
yes,
wait a
for
day or
sure.
two. But no, I
Yeah,
just think that, that if there's other similar ones across the country, that would be great for people to be able to connect to. Um,
absolutely.
this is awesome. Thank you so much. I think, we need to hear more of this because I think we can get really down on the healthcare system and not realize that one, there are lots of good health practitioners out there doing things like you are and your colleagues are. And secondly, the people are not aware of how much all these other organizations are partnering together to really reach kids. And I say kids, but it can be those older kids too, apparently, um, in different ways, right? That traditional, medical doctor clinician setting maybe isn't conducive for all of us, right? At different points in our lives. And to have all of that going on, yeah, you need to get out and tell more people about it because we will share it. But I think this has been wonderful. And thank you so much for making the time and stepping away from your conference.
Yeah,
That is
no
awesome.
problem. Thank you so much.
Yes.
I really appreciate it. And I hope the other message that people hear is the power of the family voice, because this is a model that was co-designed by family members such as all of you today. And that's why it's been so impactful. So thank you to everyone who's played a role in that. And keep going, keep speaking up, keep getting engaged. Not only around your own young person's care, but at the system level, you can have an impact.
I think what's really great is that there's the longevity of the work you've been doing and that it's evolved as society has evolved. And it follows our youth through their journey. If I think of my own case, starting with my youngest, we kind of got into this whole realm at 13. Well, that one's almost going to be 30. This is a lifetime journey that we're on, that we're all trying to navigate it changes with we change as people, society changes. And the fact that just hearing how you guys kind of go back and do a check on yourselves and do the tweaking and, kind of reset where we need to reset. And that all are welcome and that, you're kind of following people through their journey. Fabulous. Thank you so much.
You're welcome. Thank you.
And thanks to everyone. Again, a reminder, you can watch this again. There's lots of information shared on the YouTube channel or on the Sashbear website. And we look forward to seeing you at our next session. Take care, everyone. Have a great evening.
Bye, everyone.
Thanks, Joe.